Walking does more harm than good. 5 conditions seniors should consider. Staying active is crucial for healthy aging, but for some seniors, too much walking can do more harm than good. While we often hear about the benefits of walking, it's important to recognize that individual needs vary, especially as we age. In this video, we'll explore 5 common health conditions that may require seniors to adjust their walking routines to prioritize safety and well-being. Ignoring these conditions could lead to serious consequences, so stay tuned to learn how to identify potential risks and what steps you can take to protect yourself or a loved one. Condition 1. Inner ear imbalances. While not a condition in themselves, can significantly impact a senior's ability to walk safely. The inner ear plays a crucial role in maintaining balance and equilibrium. It houses the vestibular system, a complex network of fluid-filled canals and sensory cells that detect head movements and position. This information is then relayed to the brain, which uses it to coordinate muscle activity and maintain balance. When the vestibular system is disrupted, as can happen with conditions like vertigo, labyrinthitis, or Meniere's disease, it sends inaccurate signals to the brain. This can lead to a range of symptoms, including dizziness, lightheadedness, nausea, and a spinning sensation. Vertigo. These symptoms can make walking extremely difficult and increase the risk of falls. Imagine trying to walk a straight line when the world around you feels like it's constantly tilting and spinning. That's the reality for many seniors with inner ear imbalances. Vertigo, in particular, can be debilitating. It can come on suddenly and intensely, making it impossible to stand or walk without assistance. Labyrinthitis and inflammation of the inner ear can also cause severe dizziness and balance problems. Meniere's disease, a chronic inner ear disorder, can cause recurring episodes of vertigo, hearing loss, and tinnitus, ringing in the ears. These conditions can significantly impact a senior's quality of life, making everyday activities like walking challenging and even dangerous. The impact of inner ear imbalances on walking goes beyond the immediate symptoms. The fear of falling can lead seniors to restrict their activities and become less mobile. This can have a cascading effect, leading to muscle weakness, decreased bone density, and a decline in overall health. It's a vicious cycle that can be difficult to break. Fortunately, there are ways to manage inner ear imbalances and improve balance. Physical therapy plays a vital role in helping seniors regain their balance and coordination. Vestibular rehabilitation therapy, a specialized form of physical therapy, focuses on exercises that retrain the brain to compensate for the inaccurate signals coming from the inner ear. These exercises can include head movements, eye exercises, and balance training activities. In addition to physical therapy, certain medications can help manage the symptoms of inner ear disorders. Doctors may prescribe medications to reduce dizziness, nausea, and inflammation. It's important to work closely with a healthcare professional to determine the best course of treatment for individual needs. If you or a loved one is experiencing dizziness, vertigo, or balance issues, don't hesitate to seek medical attention. Early intervention is key to managing inner ear imbalances and preventing falls. Condition 2. Vision impairment. Often an overlooked factor in senior mobility, can significantly impact a senior's ability to navigate safely while walking. As we age, various eye conditions can diminish our visual acuity, depth perception, and ability to adapt to changing light conditions. These changes can create a multitude of challenges for seniors who wish to maintain an active lifestyle through walking. One of the most significant impacts of vision impairment on walking is the reduced ability to perceive depth accurately. Depth perception allows us to judge distances and the relative positions of objects in our environment. This is crucial for navigating uneven terrain, avoiding obstacles, and judging the distance to curbs, steps, and other potential hazards. Seniors with impaired depth perception may misjudge the height of a step, stumble over a crack in the sidewalk, or bump into objects they didn't perceive accurately. Another challenge is the difficulty seeing obstacles clearly. Conditions like cataracts, macular degeneration, and glaucoma can cloud vision, reduce contrast sensitivity, and create blind spots. This makes it harder to see objects in the path, especially in low light conditions or when there is glare. A simple walk in the park can become a hazardous undertaking if a senior can't clearly see tree roots, rocks, or uneven pavement. Even indoors, changes in flooring, furniture placement, or the presence of pets can pose a tripping hazard for those with diminished vision. Sensitivity to glare is another common problem associated with aging eyes. Bright sunlight, reflections from water or shiny surfaces, and even indoor lighting can create a glare that makes it difficult to see clearly. This can be particularly problematic while walking, as it can temporarily impair vision and increase the risk of accidents. Imagine trying to cross a busy street with the sun reflecting off a car windshield. The glare can make it almost impossible to see oncoming traffic. The cumulative effect of these vision impairments can significantly increase the risk of falls. Tripping over unseen obstacles, misjudging distances, and losing balance due to glare can all lead to falls, which can have serious consequences for seniors. Falls are a leading cause of injury and hospitalization among older adults, and they can have a devastating impact on independence and quality of life. Fortunately, there are strategies and resources available to help seniors with vision impairment walk more safely. Regular eye exams are essential for detecting and managing age-related eye conditions. Corrective lenses, such as glasses or contacts, can often improve visual acuity and reduce the impact of refractive errors. Low vision rehabilitation services can provide training and assistive devices to help seniors adapt to vision loss and maintain their independence. Simple modifications to the walking environment can also make a big difference. Ensuring adequate lighting, removing clutter and tripping hazards, and using contrasting colors to mark steps and changes in elevation can create a safer walking environment. Using a cane or walker can provide additional stability and support, especially for those with balance issues. Finally, it's important to remember that fear of falling can be a significant barrier to staying active. Encouraging seniors with vision impairment to participate in safe and supervised exercise programs can help them build confidence, improve their balance and coordination, and maintain their mobility. By addressing vision impairment proactively and implementing appropriate strategies, seniors can continue to enjoy the physical, mental, and social benefits of walking while minimizing the risks. Condition 3, osteoporosis. A prevalent condition among seniors, significantly impacts bone health and increases the risk of fractures. This silent disease often progresses unnoticed until a fracture occurs, typically in the hip, spine, or wrist. While walking is generally recommended for maintaining bone density, in advanced cases of osteoporosis, the impact of each step can place undue stress on weakened bones, potentially contributing to fractures, especially in the event of a fall. The repetitive impact of walking can exacerbate microfractures in already compromised bone tissue, increasing the risk of more serious fractures. Consider the case of 75-year-old Helen, diagnosed with osteoporosis after a seemingly minor fall, resulted in a fractured wrist. Prior to the incident, Helen enjoyed daily walks, unaware of her underlying bone fragility. The diagnosis served as a wake-up call, prompting her to reevaluate her exercise routine and prioritize bone health. Her doctor advised her to modify her walking routine to minimize the risk of further fractures, suggesting shorter, less impactful walks on even surfaces, and emphasizing the importance of fall prevention strategies. Helen's story highlights the need for a tailored approach to exercise for seniors with osteoporosis. While complete cessation of activity is not recommended, modifications are often necessary to balance the benefits of exercise with the risks posed by weakened bones. Helen incorporated weight-bearing exercises like water aerobics and resistance training, which are gentler on the joints while still promoting bone density. The buoyancy of water supports the body, reducing stress on bones during water aerobics, while resistance training strengthens muscles, providing additional support for the skeletal system. She also started using a walking stick for added stability during her shorter walks, reducing the risk of falls and minimizing the impact on her bones. Furthermore, understanding the progressive nature of osteoporosis is crucial. Bone density naturally declines with age, but osteoporosis accelerates this process, making bones increasingly porous and susceptible to fractures. This highlights the importance of early diagnosis and proactive management. Regular bone density screenings can help detect osteoporosis in its early stages, allowing for timely intervention and preventative measures. Lifestyle modifications, including a balanced diet rich in calcium and vitamin D along with regular exercise, play a crucial role in managing osteoporosis and maintaining bone health. In addition to exercise modifications and lifestyle changes, medical treatments are available to slow the progression of osteoporosis and reduce fracture risk. Medications, such as bisphosphonates and denosumab, can help increase bone density and reduce the likelihood of fractures. These medications work by slowing down bone breakdown and promoting bone formation. Consulting with a healthcare professional is essential to determine the most appropriate treatment plan based on individual needs and the severity of the condition. By adapting her exercise routine, focusing on fall prevention, incorporating appropriate weight-bearing exercises, and seeking medical guidance, Helen was able to stay active without jeopardizing her bone health. Her experience underscores the importance of a comprehensive approach to managing osteoporosis, combining lifestyle modifications, exercise adjustments, and medical interventions to maintain bone health and minimize fracture risk, while preserving an active and fulfilling lifestyle. Condition 4. Respiratory conditions. Seniors with conditions like COPD or emphysema may find that walking, especially at a brisk pace or in hilly terrain, exacerbates their breathing difficulties. The increased demand for oxygen during exertion can lead to shortness of breath, chest tightness, and even respiratory distress. This is because these conditions compromise the lungs' ability to efficiently exchange oxygen and carbon dioxide. COPD, or chronic obstructive pulmonary disease, is a progressive lung disease characterized by airflow limitation that interferes with normal breathing. Emphysema, a common form of COPD, involves damage to the air sacs, alveoli in the lungs, making it harder for them to expand and contract properly. This damage reduces the surface area available for gas exchange, leading to reduced oxygen uptake and increased carbon dioxide levels in the blood. Imagine trying to inflate a balloon that has lost its elasticity. It requires more effort and doesn't expand as fully. Similarly, damaged air sacs in the lungs require more effort to inflate, leading to breathlessness and fatigue. When a senior with COPD or emphysema engages in physical activity like walking, their body's demand for oxygen increases. However, their compromised lungs struggle to meet this increased demand, resulting in shortness of breath and discomfort. This can be particularly challenging during activities that involve greater exertion, such as brisk walking or walking uphill, where the demand for oxygen is even higher. The added strain on the respiratory system can make even simple walks feel like a strenuous workout, leading to frustration and discouragement. The impact of these respiratory conditions on walking can extend beyond physical discomfort. The fear of experiencing breathlessness or respiratory distress can lead seniors to limit their physical activity, contributing to a sedentary lifestyle. This can have a cascading effect on overall health, leading to muscle weakness, decreased cardiovascular fitness, and a decline in overall well-being. It's a vicious cycle that can be difficult to break. Furthermore, reduced physical activity can exacerbate the symptoms of COPD and emphysema, further limiting mobility and quality of life. Fortunately, there are strategies and resources available to help seniors with respiratory conditions manage their symptoms and maintain an active lifestyle. Pulmonary rehabilitation programs are designed to improve lung function, manage shortness of breath, and enhance overall quality of life. These programs typically involve supervised exercise training, education on breathing techniques, and strategies for managing daily activities. Learning effective breathing techniques, such as pursed-lip breathing, can help seniors control their breathing and reduce shortness of breath during physical activity. Medications, such as bronchodilators and inhaled steroids, can also help manage the symptoms of COPD and emphysema. Bronchodilators help relax and open the airways, making it easier to breathe. Inhaled steroids help reduce inflammation in the airways, improving lung function. Oxygen therapy may be necessary for some individuals with severe respiratory conditions to maintain adequate oxygen levels in the blood. It's essential to work closely with a healthcare professional to develop an individualized treatment plan that addresses specific needs and limitations. In addition to medical interventions, lifestyle modifications can play a significant role in managing respiratory conditions and improving walking tolerance. Avoiding exposure to irritants, such as tobacco smoke and air pollution, is crucial for protecting lung health. Maintaining a healthy weight can also reduce the strain on the respiratory system. Regular, moderate-intensity exercise, tailored to individual capabilities, can improve cardiovascular fitness and lung function. Walking, even at a slower pace or for shorter durations, can still provide significant health benefits for seniors with respiratory conditions. Breaking down walks into smaller, manageable segments with rest periods can help conserve energy and prevent breathlessness. Choosing flat, even terrain and avoiding hills can also reduce the strain on the respiratory system. Walking with a companion can provide emotional support and ensure assistance is available if needed. By understanding the impact of respiratory conditions on walking and implementing appropriate strategies, seniors can continue to enjoy the physical, mental, and social benefits of walking while minimizing the risks. With proper management and support, seniors with COPD and emphysema can maintain an active lifestyle and improve their overall quality of life. Condition 5. Neurological conditions. Neurological conditions encompass a wide range of disorders affecting the brain, spinal cord, and peripheral nerves. Conditions such as Parkinson's disease, multiple sclerosis, MS, and stroke can significantly impact a senior's ability to walk safely and effectively. These conditions can disrupt the intricate communication pathways between the brain and the muscles, leading to a variety of mobility challenges. Parkinson's disease, a progressive neurodegenerative disorder, affects movement control. It's characterized by tremors, rigidity, slow movement, bradykinesia, and postural instability. These symptoms can make walking difficult, increasing the risk of falls. Individuals with Parkinson's may experience a shuffling gait, difficulty turning, and a tendency to freeze, especially when initiating movement or navigating tight spaces. Imagine trying to walk with stiff muscles, uncontrollable tremors, and a feeling of being stuck in place. That's the reality for many seniors with Parkinson's disease. The progressive nature of the disease means that walking difficulties often worsen over time, requiring ongoing adjustments to mobility strategies and support. Multiple sclerosis, MS, is another neurological condition that can significantly impact walking ability. MS is a chronic autoimmune disease that affects the central nervous system, including the brain and spinal cord. The damage caused by MS disrupts the transmission of nerve signals, leading to a range of symptoms, including muscle weakness, numbness, tingling, balance problems, and coordination difficulties. These symptoms can make walking challenging, increasing the risk of falls and injuries. The unpredictable nature of MS means that walking abilities can fluctuate, with periods of relative stability followed by periods of exacerbation, where symptoms worsen. This can make it difficult for seniors with MS to maintain a consistent walking routine and requires ongoing adaptation to changing mobility needs. Stroke, a sudden interruption of blood flow to the brain, can also have a profound impact on walking ability. A stroke can damage brain tissue, leading to a variety of neurological deficits, including muscle weakness or paralysis, hemiparesis, sensory impairments, balance problems, and difficulty coordinating movement. These impairments can make walking challenging or even impossible, depending on the severity and location of the stroke. Recovery from a stroke can be a long and challenging process, and many individuals require ongoing rehabilitation to regain lost function and improve their walking ability. Physical therapy, occupational therapy, and speech therapy can play a vital role in helping stroke survivors regain their independence and improve their quality of life. The impact of these neurological conditions on walking extends beyond the physical challenges. The fear of falling, the frustration of limited mobility, and the social isolation that can result from difficulty walking can significantly impact a senior's emotional well-being. It's essential to address not only the physical symptoms, but also the emotional and social consequences of these conditions. Fortunately, there are interventions and support systems available to help seniors with neurological conditions maintain their mobility and independence. Physical therapy plays a crucial role in improving balance, coordination, and gait. Therapists can design individualized exercise programs to strengthen muscles, improve range of motion, and address specific mobility challenges. Assistive devices such as canes, walkers, and wheelchairs can provide additional support and stability, enabling seniors to maintain their mobility and participate in daily activities. Occupational therapy can help seniors adapt their home environment and develop strategies for managing daily tasks, promoting independence and safety. Support groups and community resources can provide emotional support, practical advice, and a sense of community for seniors with neurological conditions and their caregivers. In addition to these interventions, ongoing medical management is essential for controlling the symptoms of neurological conditions and slowing their progression. Medications, such as those used to manage Parkinson's disease or MS, can help reduce symptoms and improve quality of life. Regular checkups with neurologists and other healthcare professionals are crucial for monitoring the progression of the disease, adjusting medications as needed, and addressing any new or emerging symptoms. By combining medical management with rehabilitation therapies, assistive devices, and social support, seniors with neurological conditions can maintain their mobility, independence, and overall well-being. It's important to remember that each individual's experience with a neurological condition is unique, and a personalized approach to care is essential for achieving optimal outcomes. In conclusion, while walking is a fantastic exercise for seniors, certain health conditions may require adjustments to ensure safety and effectiveness. By recognizing potential risks and working with healthcare professionals, seniors can modify their walking routines or explore alternative forms of exercise to maintain an active and healthy lifestyle. Remember, listening to your body and prioritizing safety are essential for enjoying the long-term benefits of physical activity. What are your thoughts on this topic? Share your experiences and insights in the comments below. And if you found this video helpful, please like and subscribe to stay updated on future videos. Don't forget to hit that notification bell so you don't miss out on our latest tips on life after 60, all for free. Your support helps us create more valuable content like this. So hit that like button, subscribe, and join our community of thriving seniors. Thank you for watching.